saw the doctor there in Rivers State confident to say there is availability of these vaccines. But what we're hearing from the numbers and where Nigeria is ranked, you tell us, where are we?
Where are we? That's a good one to ask. But before I go into the where are we, I just want to say that, yeah, the doctor that spoke is actually correct. We have vaccines in the health facilities, public health facilities. You call them primary healthcare centers across the country. They're basically over 28,000 of them where these services, PSC services, not just immunization, maternal and child health care and growth monitoring and all of that happen. So yes, we have a program, the immunization program that has been on for over 2 decades so far. And we have what we call a national immunization schedule that prescribes how these vaccines should be given, the timing of the vaccine, and also the site of the vaccine, and when you need to repeat for vaccines that have a more than one series, like the Penta vaccine that the reporter talked about, which she called DPT, yeah, but it's not Penta, it has 5 antigens there. And these vaccines are actually there, they're free. And in recent times, our survey showed us that we have made some slight progress from the last time we had the National Demographic Health Survey in 2018 to when we now have this, the one of 2023. We showed a slight progress of 3 points. So we're from 50% now, we're at 54%. And we're looking good in terms of how we are beginning to restructure the program, how we are beginning to restructure the health system in general, not just MPACD here, but being guided by the Federal Ministry of Health under the whole swap arrangement. Immunization is just one part of all of the services. So we would say we have challenges, no doubt about that. However, we are working with all of our partners, our donors, our state and subnational level actors, who are also the PSC workers, so to say. We have at the state LGA and also at the settlement level where these vaccines are actually administered.